So we are the Healthcare System Interest Group, formerly the Electronic Health Record Working Group. And this is our February 2022 update. My name is Melanie Philofsky. So we're going to start with OHDSI's mission statement. And that is to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. And in order to achieve this goal, first, we need to help the community convert their data to the CDM. And that was how this work group was born. Healthcare systems, hospitals, and other friends with EHR data needed some guidance. So in keeping with the OHDSI tradition, we're going to do a quick little journey. So we began as the Electronic Health Record Working Group back in 2018 at the OHDSI Symposium in Bethesda, Maryland in the US. I had met a lot of community members with EHR data who had a lot of questions about the OMOP CDM, their source data, the tools, the research, and the community. And since we're an open source, open science community, if you have or see a need and you have an interest, it's up to you to work towards a solution. So I gathered the names and email addresses and posted to the forums and reached out to my colleagues and set up our first meeting for November 2nd, 2018. And we started with using Google Docs, where all our meeting minutes are, and they still are on Google Docs now in the MS Teams. We've had a lot of presentations and discussions, including things like custom mapping, 2 billion errors versus the source concept map. We talk about updates to the vocabulary and to the model. We've had folks present how they have implemented some of the optional CDM tables, such as the visit detail table. Also, different ETL methods and ETL tools, either homegrown tools and methods, alongside with the regulars like Rabbit in a Hat and White Rabbit. We've had folks present about OHDSI Stack, including Docker, the data quality dashboard, COVID mapping in your electronic health record, and the list goes on. It's all in our meeting minutes. And we do a lot of discussing of how do you OMOP your data. So now here we are 3 years later, and we've grown a lot over the past 3 years. The whole community has grown a lot. And we've grown with the community, and we realized that the title of our group, the Electronic Health Record Working Group, and the EHR objectives weren't quite accurate anymore. So over a few meetings last fall, we updated our objectives and rebranded ourselves based on these new objectives. So now we're the Healthcare Systems Interest Group. We went with interest group because work is only done by a core group of people, being Dawn Tora, Paul Nagy, and myself. We implement the group's objectives, we take notes, we secure speakers, and we provide a lot of guidance to the group. So this is what we've come up with our OKRs for 2022. These are not finalized. We have our working group summit at the end of this week. So I'm thinking probably in the next couple of weeks, we will finalize these. Always like to hear input from the community. So we have 3 objectives right now. One is to provide support for transforming source EHR data to the OMOP CDM. Second objective is to support healthcare systems with building the business case to utilize the OMOP CDM. And our third one is to provide value to healthcare systems beyond participating in OHDSI network studies. So the first objective, to provide support for transforming source EHR data to the CDM, we have some key results. So we're going to continue with our office hours style agendas during our regularly scheduled meetings. We're going to do this 10 times a year. This is so anybody can come to our meeting and have any questions about the OMOP CDM, their source data, transforming it, vocabularies. Either one of us will help you with that, and we can discuss it. And if we don't know, we do know the people that can help you with this. So that's just an open type of forum for discussions. Another key result is we're going to monitor and answer questions on the CDM builders, the implementers, and the categorized forums of OHDSI related to anything about the source data or the ETL process. And then we're also going to create a central repository of the different OMOP sites and the underlying EHR system. We're going to do this by building a survey and then making those results available to the community. So that way community members can get together in between themselves and discuss how they've ETL'd their data. I know a lot of people would like to have scripts available for some of the common electronic health record systems like Epic and Cerner, but that is proprietary data, so we are not able as a work group to provide that. However, we are going to try to set up like a mentoring type of network so that way folks can reach out to other folks individually. We want to support healthcare systems with building the business case to utilize the OMOP CDM. We're going to provide documentation via either published papers or written by our group to support the business case for healthcare institutions to adopt the CDM. We realize that transforming source data to the CDM is a big lift. And by making resources available to the community and supporting ETL efforts, we hope to lower these barriers of adoption. So we're going to collaborate with the education work group via work group liaison to help support these EHR ETLs and also identify OHDSI sources of knowledge and put this into a wiki. A lot of times we see a lot of questions on the forums about how do I do this or where can I find that? And it would be nice to just have a wiki that lists everything out that you could just point people to, and that way their questions are more easily answered. And then our third one is to provide value to healthcare systems beyond participating in OHDSI network studies. And this objective is a little bit trickier for us, and we would really appreciate some community feedback on our key results. The first two key results we have is, this is something that's been discussed a lot in the forums and also within the working group, is some type of cohort builder with patient level data export. So Atlas can do that, but it can build your cohorts for you, but you can't pull patient level data out of that for use in like machine learning, AI, anything like that. So that's been a topic of discussion recently. And then also OHDSI is not meant for operational reporting. It's observational research. But we think that if we could figure out a way to do operational reporting, and maybe this is something that the FIRE working group is working towards too, is that would provide a lot of value to healthcare systems. And then we have a possibly unknown other key results for this objective of ours. So please help us by providing feedback on this. So if you want to join our journey, we're in MS Teams, we're on the forum. Our next meeting is Monday, February 14th at 10 a.m. Eastern time. And we meet every other Monday in MS Teams. So please find us there.